My project is over acuity-based staffing. The objectives are to discuss what acuity-based staffing is, provide a brief history about acuity-based staffing, discuss the benefits of using any acuity-based staffing system, discuss the barriers associated with an acuity-based staffing system, and provide examples of acuity-based staffing systems. What is acuity-based staffing? It's matching patient demands to nursing supply, and that means how much care does each patient require during a particular shift. How much time will it take to provide that care, and how many nurses the supply is available to provide that care. Acuity-based staffing is based on a simple economic concept matching patient demands to nurse supply. It is an important tool that helps to distribute nursing assignments equally with the goal of achieving improved patient outcomes. Acuity-based staffing tools are often computer-based, but can be paper-based systems as well. Computer acuity staffing systems gather complex information from a patient electronic health record to determine how many hours each nurse is projected to spend with the patient each shift. Each nurse is then distributed patient assignments based on these projects. Paper-based systems use more simplistic information to create various tools geared towards the same goal of determining the most appropriate distribution of nursing assignments based on patient predicted care needs during a 12-hour period. However, paper-based systems can oftentimes be related to nursing opinions rather than actual patient data. Acuity-based staffing, a brief history. The first major effort to group patients into categories was in 1973 at the National Institute of Health Conference. This conference involved 45 nursing research experts, which analyzed factors associated with nursing problems associated with providing patient care. This category-based classification system was later used to determine staffing assignments. This type of system is still commonly used today, primarily in paper-based formats. From this conference, the following categories were produced: patient self-care capability, patient sensory disabilities, illness acuity, nursing care requirements, skill level of staff, and geographical location within the hospital. In 1983, Medicare introduced diagnosis-related groups, DRGs, changing staffing systems. This changed how hospitals were reimbursed from a per-patient fee-based system on a patient classification based on medical diagnosis. With this change came increased use of patient classification tools and staffing assignments based upon such tools. As computer systems continued to emerge during the 1980s, so did computerized patient classification and staffing systems. However, one of the first reported computerized acuity systems took place at Children's Hospital in Akron in 1961. Using IBM software, this facility tried to quantify the nursing care needs of patients, the amount of time nurses spent on various care activities, and then developed a staff plan based on that information. Advancement in computerized technology and healthcare informatics over the last 30 years have led to staffing systems based on statistical data, patient classifications, nursing assessment, patient care requirements, and available resources. Many modern computerized staffing systems rely on data mining tools to analyze enormous amounts of individual patient information that is used to determine individual patient acuities and the combined acuities of a group of patients within each nurse's patient assignments per shift. Benefits of acuity-based staffing: equitable nursing assignments and higher nurse satisfaction. Acuity-based systems help to identify patient care needs more accurately, thus giving the person responsible for making staffing assignments more information to appropriately match nurses with patients that will complement their skills and level of experience. This in turn can lead to increased nurse and patient satisfaction and decreased nursing burnout and fatigue. Matching patient care needs appropriately leads to better patient outcomes. A 2013 study published by BMJ Quality and Safety Journal found that higher patient loads were associated with higher hospital readmission rates. Additionally, the Joint Commission determined that staffing was a contributing factor to 24% of all unanticipated events results in patient deaths, injury, or permanent loss of function. An additional benefit is decreased cost. Improved patient outcomes, nurse and patient satisfaction, and decreased staffing turnover rates, errors, and incidences of patient injury all lead to decreased costs for a facility. And these are some of the benefits an acuity-based staffing system can offer when used appropriately. Barriers associated with acuity-based staffing. Multiple studies have concluded that many acuity-based staffing systems lack the responsiveness needed to address quickly changing staffing needs, while acuity-based systems have shown reliability in long-term staff needs and trend analysis. It is not reflective of real nursing work and lacks the decision-making abilities that come with years of nursing experience and professional judgment. Resistance to change. Many nurses may also be resistant to changes associated with adopting an acuity-based staffing system, preferring a more simplistic or familiar approach. Resistance to change can be seen through a variety of ways: passive-aggressive behaviors, poor work habits, lack of effort, and an outward verbal resistance as well. With any change, resistance should be expected on some level. Strategies should be in place to mitigate such issues. Cost. Computerized acuity-based staffing systems often rely on data obtained from electronic health records, or EHRs. In 2009, the United States spent approximately $2 billion on EHRs, increasing annually at a rate of 11.5%. In 2015, that number increased to approximately $3.8 billion. Acuity-based staffing systems used in conjunction with EHRs require a significant financial investment from hospital facilities and continual cost of ownership expenditures, along with numerous personnel resource requirements needed to maintain such a system. Examples of acuity-based staffing systems. The first example is a paper-based acuity system that requires a nurse to provide subjective information about a patient based on their personal experience and observations. This system does not take into account any information such as patient lab results, diagnosis, vital signs, and projected stability of the patient's condition. Additionally, every nurse must fill out a form for each patient they're assigned to that shift. The advantages associated with this particular system include decreased cost to use versus a computerized version, and allows the nurse to provide their subjective opinion of the nursing care required per patient. Computerized systems are often integrated into electronic health records. This system is used at such facilities as Texas Health Resources, or THR. The acuity-based staffing system at THR uses data mining to analyze over 4,000 different patient indicators such as vital signs, lab values, diagnosis, frequency of request, family support, and nursing documentation. This is then used to determine the acuity of each patient and the amount of time that a nurse is projected to spend providing care to each patient. After that is done, the person responsible for making nursing assignments groups their patients together to determine their workload for that shift and ensure assignments are equitably divided amongst staff. In doing so, it provides the most reliable information available and requires very little time for staff to complete. An additional advantage of the system is the tracking capabilities it offers. The next slide provides a summarized list of some of the advantages and disadvantages discussed when using each type of system. Paper-based system advantages: cost of use. and it allows nurses to easily provide subjective patient information. Disadvantages: provides only subjective information, does not account for patient data such as vital signs, diagnosis, or projected patient stability, and time requirements to fill out forms for each patient. Computerized system advantages: decrease costs by reducing patient errors, readmission rates, and staffing turnover, greater equability of nursing assignments, time requirements to complete, provides patient acuity based on enormous amounts of patient and statistical data. The disadvantages of computerized systems include cost of use and continual cost of ownership, possible resistance to change from staff. In conclusion, acuity-based staffing systems have existed since the early 1960s in various forms. Today, paper and computer-based systems are still in use, each with its own advantages and disadvantages. However, more research is needed as many paper and computer-based systems have some of the same issues of decade-old systems, which include difficulty in measuring workload and inadequate definitions of nursing work, insufficient evidence of reliability and validity testing as well.